Hello, Dr. Robbie White, Chief Clinical Officer for Ergo-Flex Technologies. I want to talk to you more about the perfect neuropathy solution. Now, I've talked about blood supply and lymphatic supply, actually neurogenesis, the anti-inflammatory state. Now I want to talk to you about nerve transmission. Now, all these cross borders, right? But nerve transmission, look, if we got a nerve getting smashed by a disc, it doesn't matter how much we repair at the foot. If L5 disc is smashing that nerve, you can't get it past, all right? So we have to unload the compression of the nerves, whether it be peripheral nerve in multiple sites, a nerve root, spinal cord because of stenosis, in the brain because of swelling. We have to unload the compression of the nerve root in order to be able to get the nerve transmission alive again, all right? So in order to get that pathway moving, we have to make sure that nothing's smashing the nerve down, all right? That's critical. The other big factor is you have to have neurotransmitters, okay? NADH, which is a byproduct of what happens in glycolysis and Krebs cycle and electron transport, is a key element in being able to actually create neurotransmitters, acetylcholine, and so forth. Again, the foundation of that is glucose, and you guessed it, oxygen. We have to have glucose and oxygen in order to be able to make NADH, which is one of the foundations, not the only one, one of the biggest foundations for neurotransmitters. None of that happens efficiently. It almost happens at no level when there's no oxygen present and the body starts working in an anaerobic state. When it's anaerobic, it makes much less NADH and much less ATP. So therefore, we don't have, number one, we don't have the nerves not staying healthy. Number two, we can't create the nerve transmission. Now, the other side of this is we have to make sure that we are doing the right things for myofascial release. That is critical. We got to make sure that the fascia around these tissues is moving and pliable. The next big one is your chiropractic adjustment. One of the most powerful things you could ever do for a patient. There is nothing in this planet that does what the chiropractic adjustment does. Absolutely critical. The next one is so the adjustment is a high velocity, low amplitude move. That's the chiropractic adjustment. I'm going to talk to you about low velocity, high amplitude moves, okay, over a prolonged period of time. That's the back on track, all right? The knee on track, if you got a knee problem, because it's getting nerve compression, but the back on track is be one of the critical things, especially for hands and feet, okay? Feet a little bit more than the hands, but we got a cervical piece coming that's going to take care of that as well. So you have to uncompress the nerve at the spinal cord levels so that the nerve transmission can get to the brain and then back down to the motor aspect, okay? Number one, you got to be able to create the neurotransmitters. Number two, you got to be able to get the pathway clear enough so that you can get the signal back. Because if you got an 800-pound boulder laying on your arm, you got to take it off the arm or cut the arm off, right? Just take it off the arm. Same thing that's the back on track. It's a critical piece. So the back on track, in conjunction with the total brain and body O2, creates the perfect neuropathy solution to actually restore nerve transmission.